The region of Central and Eastern Europe and the CIS is experiencing the fastest rate of growth in levels of HIV infection in the world, particularly among young people. What are the factors contributing to this increase?
The HIV prevalence in the region of Eastern Europe and Central Asia has been on the increase over the last 10 years, and it is the region with the fastest growing epidemic of HIV. The largest numbers are concentrated in Ukraine and the Russian Federation, but the sharpest increases lately have been in Central Asian countries, which is Kazakhstan, Uzbekistan, Kyrgyzstan. So it is really there that we are seeing that young people are the ones who are getting infected, and there is a number of factors that are affecting risk. What you have is a situation where a lot of the countries over the last 10-15 years have gone through a very radical changes in society. The transition has affected 300 million people, and it is a transition that has created certain circumstances, like, for example, high levels of unemployment. The CECIS region is second in the world in levels of unemployment among young people. So you have the highest levels of suicide. 8 of the top 10 countries with young people high suicide rates are in this region. So there's a lot of families are in crisis. They cannot cope.
Which particular groups of adolescents are most at risk?
Clearly a number of people who are either engaging in risk behaviors themselves or those who are living under circumstances of high vulnerability. And of course the two are intermixed. So most at-risk adolescents are those that are doing the things that have an inherited risk of HIV. And then the vulnerable adolescents tend to be either children who are on the streets without adult supervision, or sometimes children in institutions, sometimes children in correctional facilities, sometimes children who are of particular ethnic groups that are discriminated against in society.
And what kind of health and information services are available for young people to find out about HIV?
There's all sorts of things available, but none of it is available at a scale that it needs to be available. And oftentimes, when you have some services, like, for example, youth-friendly health services, they may or may not be able to serve the needs of the adolescents who are excluded and, let's say, those who are at highest risk. Some services for adults, like harm reduction services, are not necessarily taking the extra step of going to reach the adolescent populations. Why? Because there's lots of barriers. Sometimes if you are providing services to at-risk populations engaged either in sex work or in drug use, you have by law a requirement to report anybody who's a minor. So that actually discourages the minors from seeking service and providers from providing service. Sometimes they turn a blind eye, and it's like a no, don't ask, don't tell policy. So when you talk to outreach workers and so on, they say, yeah, we do see adolescents, but we don't really ask them their age because we'd rather not know. Another thing that, again, you have in a lot of educational establishments, you have some form of life skills-based education. Again, enormous differences in quality of the content. Sometimes it's a biology class of 1 hour and that's it. Sometimes it's really much more intense work with young people, involving young people in the process and so on.
And what is UNICEF doing to ensure that HIV prevention services meet the needs of these young people?
First of all, what we're doing now is to try and first get the evidence of what are the risk profiles of those young people who are at highest risk of HIV. What is it that they do? What are their behaviors? What do they believe in? What is their level of use of services at the moment? What do they see as barriers to the use of services? And after that, we're trying to continue to advocate with key partners, including governments, that this is a population that needs to be addressed. Because, you know, when you combine sex and drugs and minors, it is a deadly, explosive, it's politically an explosive combination. So oftentimes there is a reluctance by national partners to address this population because there's always somebody who is going to get on your back for it. Either parents associations or community associations or religious associations, somebody will be unhappy because you're either telling the young people something that some adults would rather not have them hear, or you are setting up like a drop-in center for what they call socially ill-adapted kids in a neighborhood. It's an environment where you have to keep working with partners to create first team of people who are really keen to do something about the problem. And then we're working at two levels. We're working to make sure that the national AIDS policies and national AIDS strategies address the needs of adolescents who are at highest risk of HIV. And we're also working on making sure that, for example, non-governmental organizations that are working with adults at risk also start to look at the special needs of adolescents at risk. We're also trying to work on removing some legal obstacles. For example, in some countries, you cannot go for an HIV test if you are under 18 without parental consent. Now, for a lot of adolescents, the last thing they want is to get their mom and dad to sign a paper that it's okay for them to go get an HIV test, because it's something they'd rather not tell anyone. And so we're trying to lower the age that the adolescents can access services without necessarily having a written consent from a parent. The largest challenge, of course, is to scale services up to the level that they need to be scaled up to. And that is something that's a collective challenge, not just for UNICEF, but for everybody else working. And another thing that is important is that when some of these services are being developed, to really work with the young people to make sure that they have a say in what happens. It's not about working with those young people who are the best students in the school. It's working with those who are, marginalized, who are not integrated into society. Actually, working with them is a very difficult thing to both get them engaged and also get society to listen to what they have to say.
Could you talk about some of your future plans for HIV prevention in the region?
Well, one of the things that we would like to work on is the whole issue of preventing adolescents from initiating, let's say, high-risk behaviors such as drug use. Because even though people think that, adolescents are initiated into drugs by these nasty drug dealers and so on, in fact what happens is that 85% of adolescents, or sometimes higher percentage, actually get initiated into drugs by their friends and by their siblings. So really to try and work on ways to reduce that startup of risk behaviors. Another set of interventions is linking some of the work on HIV prevention to work on social protection. Because again, there is a number of situations where young people who are HIV positive are, let's say, excluded from services, or the child protection services do not necessarily address the needs of those populations. The other areas have to do with, let's say, adolescents who are in institutions. There's very high numbers in our region who are still in institutions, working with them. Because again, some statistics indicate that after they are out of the institutions at age 18, they're not ready to take on jobs and so on. So they end up, a large proportion of them end up in situations where they are out of work, out of school, and then enter into the cycle of alcohol, drugs, underground activities which are linked to risk of HIV.
To find out more about UNICEF's work to prevent HIV infections among young people, visit www.unicef.org.uk/unite.